Today we will discuss about Dracunculus medinensis. So, it belongs to phylum Nemathelminthes, class nematodes. So, it is the longest worm. So it is the longest nematodes which measures about 1 meter, and the smallest nematode is Trichinella spiralis. So, Trichinella spiralis we will discuss later. So, the males are usually smaller. So, the anterior end will be curved, whereas the posterior end will be usually coiled. So, generally all the worms will be like this, like anterior will be curved and posterior will be coiled. So, coming for proper characters of guinea worm. First, it is in the adult worm, it is usually 4 cm. In the female worm, it is 120 centimeters. It is in viviparous, that is, it will be laying a larva directly instead of eggs. If it is laying eggs, it is called as an oviparous. Definitive host, it is in man. Intermediate host, it is in cyclops. Infective form, it is in larval stage, that is an L3 form present inside the cyclops. How it got transmitted is by ingestion of the water contaminated within cyclops containing L3 larva. So it usually resides in subcutaneous tissue. Coming for life cycle, definitive host, it is in man. Intermediate host, it is in cyclops. So specific species is Mesocyclops leucarti, which is present in India, but the disease is now eradicated all over the world. So the eradication was very easy because of 3 points. So one, it has a simple life cycle. Second, it has a localized distribution, that is, it is usually present in the lower limb. And third, it is in low animal reservoir. So because of these 3 reasons, the disease got easily eradicated from the world. So one, it is in simple life cycle. Second, there is no animal reservoir. Third, because of a localized distribution. So coming for life cycle, what happens is the man, if he accidentally drink the water which is contaminated with the cyclops will enter into the stomach, it gets digested, and the L3 larva will be released. So this L3 larva enters into the subcutaneous tissue of the man. It will be developed into an adult worm. So once it develops into an adult worm, it will be laying a larva once it come in contact with the water. So the water sources like any ponds or the rivers, whatever it can be. So this worm usually present in lower limb. I told already, that is in lower extremities, so that it can easily come in contact with the water, so that it can able to discharge the L1 larva into the water. So now this L1, it is in motile form. So it will be entering into the cyclops. There it will be developed into an L3 larva, and again the cycle continues. So the main point is the infective form to the man, it is an L3 larva, which is present inside the cyclops. So coming for pathogenicity, the disease, it is called as an Dracunculus or Dracunculus. So I told already, it is an infected cyclops. Source of infection, infective agent, it is a larva, that is an L3 form. It enters by drinking a contaminated water with cyclops. Usually resides in subcutaneous tissue, that too most common in the lower limbs. Incubation period is for about 1 year. So pathogenic effect, the symptoms are, it is usually manifested during the parturition time of the female worms. So it will be releasing in some of the allergic substances which will be causing skin manifestation and the blister formation. So via that blisters only, the worm tries to come out to lay to discharge the larva. So if the blister got contaminated by secondary organism like bacterial infection, it can lead to sepsis. So coming for blister formation, it is usually present in the lower extremities, and there will be an itching and burning sensation. So there will be a small red spot, that is, If there is a blister fluid, it will be a sterile, it will be an yellow in color, it contains monocytes, eosinophils, neutrophils and many embryos, that is in larval stages. So because via the blisters, the larva will be coming out and entering into a water. So lab diagnosis is, first you can detect the adult worm on the surface of skin. Second, it is by detection of the embryo, that is we will be taking a fluid and we will be pipetting out into the slide and we will be focusing under the microscope for the larval stages. So intradermal test is, we will be injecting a Dracunculus antigen and there will be a wheal formation in 24 hours. And sometimes these worms will get calcified, so that can be seen in the X-rays. Since it is an allergic manifestation, there will be an eosinophilia in the blood. So treatment, it is by mainly two drugs, that is metronidazole and thiabendazole. Okay. So there was a technique called stick technique. So it will be usually performed in the ancient times. What they will be doing is, they will be taking a long stick, they will be twisting it around the worm and they will be pulling out the worm gently. So it will be about, takes 15 to 20 days to complete the procedure, but the worm will come out and it is an effective method. Okay. But nowadays it's not practiced. Surgical removal of worm under anesthesia can also be done. It is all done in previous days because now the guinea worm is completely eradicated from the